Okay, so you've had a dental in for the day, so they've had a dental scale and polish, maybe some extractions. The dog is ready to go home, or the cat is ready to go home. What are you going to do in your discharge appointment to get the owners to understand what's happened and what the next stages are? So what is very handy is to actually have a discharge form that's specific for your dental. So it's, as a generic one, explaining to owners what they are to expect when they get their pet home. So, post-anaesthetic, maybe feeding bland food, specific diets, that they may be groggy for 24 hours, vomiting if potential from anaesthetic side effects. So, general, but then also the dental part of it as well. So how many teeth, they always want to know how many teeth were taken out. So, state on there that how many teeth that they've had taken out, that they've had a scale and polish, that they may notice a bit of blood in their mouth for a day or two. But then again, warn the owners that if this goes on for more than a day or two, then do get back in touch with the practice. So again, reiterating and warning the owners what they may or may not see, and to give us a call, give your practice a call if they're not happy or not worried. So having your own generic dental discharge form is extremely handy, and again, it's something the owner can take away. They don't have to remember everything you've said in that discharge appointment. They can go away, have a read of it at home, and go, oh yes, I remember her pointing to that on there and saying about that. And again, it's also handy to have a bit about medication, so usually would be pain relief to go home, and potential antibiotics. They've already been on an antibiotic course. So this is a very handy tool to use. It's also nice for the owners as well to go home with maybe a record chart as well, which explains maybe which teeth have been taken out, so the owners are aware which side of the mouth that may be more tender. So if the animal is eating a little bit to one side for a couple of days, then they know that that's because they've had teeth taken out on one side. So having these prepared is extremely handy. And then actually going through with the owners, what post-dental care can they provide? Have they already had a dental nurse go through with them what they're able to do? Have they got toothbrushes? Have they been doing the training? How have they been getting on? So support the owner and make them understand that you want to be there to help them. So have they got toothbrushes? Have they got toothpaste? Are they ready for that stage yet? And again, explain that possibly they might want to leave it for a day or two before they continue with toothbrushing, especially if there have been extractions and there are sutures in the gums, that the gums have been sutured together. And toothbrushing is the gold standard. This is what we want our owners to do. We want them to be there with a toothbrush and a toothpaste, and physically removing the plaque from their pets' mouths. If they can't do it, get them to understand as well that it's not a big thing. If they really, really struggle, maybe they can't, they're older, they're arthritic, the owners, or the pet really won't tolerate it, there are other methods that we can provide dental care. So just don't, try not to say, yes, this must be it and that's it. There are other things that we can do. So even things like dental diets, dental chews as well. Obviously you might have to be aware with pets that may be a little bit overweight, or on specific diets for other health complications, but even the use of dentisticks or any sort of other sort of chewy products, dental diets, Hill's TD, they are the next best thing. They are still good enough as long as the pet chews them though. If they're a pet that just chomps and swallows, it's not really going to be doing much for their teeth because they're just taking one bite and having a swallow. So a pet needs to be having a chew, but even some toys, so sort of ragger rope toys, if they're interactive with toys, getting them to chew on those will also help brush those teeth as well. Also the training brushes, so these are ideally used for training brushes, but if that's all that they can do, they can't handle a toothbrush but they can do that, again that's better than nothing. And the same that we have the cloth brushes as well that are quite handy. Even if they've got a flannel on their finger and they're able to do that, it's better than nothing. And the next stage, if they really can't do anything physical with their pet and the pets won't eat these or they can't because of a health issue with diets, then there are other things that we can use to put in food or to put in water. So there are Verbot products as well that you can put in the water. So when they have a drink, it's almost like a mouthwash, but it's safe enough for them to swallow as well. There's also Placoff that is a granules that just gets sprinkled on the food. It's got a tiny little scoop in there. And again, that helps work internally to help with the composition of the saliva in the mouth. So there are other things, but ideally if we can try and get the owners onto the gold standard toothbrushing, that would be brilliant. Otherwise, explain to them that don't stress about it too much, don't stretch your pet out about it, and take it very, very slowly, and get them understanding that they can do other things as well.